As HIV/AIDS continues to be a major health threat around the world, a number of stakeholders globally have been making efforts to eradicate the stigma and discrimination associated with the virus. On Friday, at a meeting held at the Regency Suites for the establishment of the National Stakeholder Group on HIV-related stigma and discrimination and a partnership agreement, UNAIDS multi-country director Dr. Richard Aminaya, in its virtual presentation on the Global 2021 to 2025 AIDS strategy, explained that it seeks to reduce the inequalities that drive the AIDS epidemic and get the world on track to end the disease reign as a public health threat by 2030.
To achieve that shared vision of zero new infections, zero AIDS-related deaths, and zero discrimination. This is what we are all working towards.
Aminaya further explained that the initiative also aims to identify, reduce and end inequalities that represent barriers to people living with and affected by HIV, countries and communities. While the strategy focuses primarily on ending the epidemic, the director underscored that the 10-10-10 targets, which state that by 2030, less than 10% of countries should have punitive legal and policy environments that deny or limit access to services. Less than 10% of people living with HIV and key populations will experience stigma and discrimination, and less than 10% of women, girls, people living with HIV and key populations will experience gender inequality and violence.
So that we have a deeper understanding of what it means in terms of the law, what it means in terms of how people experience stigma and discrimination. I'm talking about key populations, I'm talking about persons living with HIV, and then also how the social barriers negatively impact women and girls.
Meanwhile, Program Manager at the National AIDS Program Secretariat, NAPS, Dr. Tariq Jagnaring, noted that human rights-related interventions into stigma and discrimination play a critical role in addressing and fighting HIV/AIDS in Guyana and around the world.
There's an urgent need to end stigma and discrimination, especially against persons living with HIV, our key populations, men who have sex with men, transgender people, female sex workers, male sex workers, and other vulnerable groups, not neglecting our migrants.
Jagnaring added that every citizen, particularly those in the healthcare sector, should be involved in addressing the stigma related to HIV. The presenters also called for civil society, communities and policymakers, regionally and internationally, to get involved in fighting to eradicate the epidemic. Reporting for the AGP 90 News, Joel Vogt.